So now we will talk about the ENT manifestations of the HIV. We already talked about different symptoms of the acute HIV infection and how it affects the whole body. But now specifically we will discuss about the HIV manifestations of the ENT. And very common is the opportunistic of infection. Opportunistic infection, as the name shows, is once the immune system of the individual becomes weak or CD4 cells are more and more CD4 cells are affected or destroyed, immune system becomes weak, then there are different infections. They take the opportunity. That's why they are known as opportunistic infections, because infections which are usually not very common in normal healthy individual with a good immune system, they attack the individual and they become serious. One of the very common infection is the candidal infection. Candida is the fungi that lives normally in the human body, present on the skin, but when the immune system becomes weak, it attacks the body and it causes infection. This is the picture showing the oral thrush, and it is due to the Candida albicans. So candidal infection becomes common. It's one of the opportunistic infection. Some unusual malignancies also occur. One of the example of these unusual malignancies, we can say Kaposi sarcoma. Kaposi sarcoma is common in patients who have HIV infection, again as a result of the decreased immune response. Then there are also some neurological disorders become common after the HIV infection.